All right. How's it going, everybody? This is Dr. Austin Quon here. I am so excited that I get to present this content to y'all. I'm excited for people who are tuning in on Facebook, Instagram, social media, YouTube, wherever you might be in the world. This is a great time just to be alive. And we've never had more research in the history of mankind than how important your nervous system is overall for your overall health, your function, and just making sure that you're getting the most out of your body. So today what we want to talk about is the vagus nerve, and my workshop today is called Welcome to Vegas. It's a cool little play on words, but we're going to get into really some of the content of how important your vagus nerve is for your overall function. And again, most people aren't really aware of this. Neurologists, medical doctors, cancer doctors even, are all talking about the vagus nerve functioning and how we can try to manipulate the way that the vagus nerve is working in order to help get better results out of our patients. So today we're going to go on a little journey, but I just want to start off by making sure that people understand that we practice as chiropractors on the premise that the power that made the body heals the body. And truthfully, that is the most powerful premise that I think anybody can really understand, is that what was created at the beginning of time, one sperm, one egg met and made 37 trillion harmoniously functioning cells, that constant force is always working within all of us. Your DNA is constantly being expressed a certain way. There's certain tools and certain factors that your body's using at every second of every day to make sure that you're getting the most out of your system. So what we want to do is think about the factors that keep us healthy rather than wait until you're starting to get sick or you're starting to show signs of deterioration to actually do something about your health. And that's a salutogenic model that we're moving towards in healthcare. As a young doctor, and a lot of the doctors that I'm working with these days, that's really the model that we're working with. Is we want to see people healthy and keep them healthy and focus on the physiological, anatomical factors that keep a person healthy. So even Harvard medical researchers understand that the power of the body, the wisdom of the body to heal, is almost 90% of the patient's hope to recover, and it's always in favor of life rather than death. So we know that your body has this innate ability to heal itself, and that's what we need to really tap into. And as a chiropractor, we know that the nervous system is connected to all of these organs. So your body has so many different organ systems: circulatory system, respiratory system, digestive system, but all of these systems, one way or another, are quarterbacked by your master commanding system, and that is your neurospinal organ, as we like to call it, or your brain and your central nervous system. And if you look, it's connected all as one piece. So when we talk about what is the nervous system affecting, it's affecting everything, and it's really quarterbacking and directing what's happening at any given time in your body. It's helping the crosstalk between different organ systems, again, so that you are promoting better homeostasis, harmony, equilibrium in your body. And all of those factors, again, are promoting better health, better wellness, and allowing your system, each system in your body, to get the most out of each cellular function, tissue function, and organ function ultimately. So it's really, really important that we get these systems firing at all cylinders. But it's really, really important we understand that there's a portion of your nervous system that you can consciously control, and then there's a bigger portion of your nervous system that you can't consciously control, that's constantly working inside of you all the time, and it's not necessarily something you're thinking about all the time. So we have a division of your nervous system called the parasympathetic and a division called the sympathetic. And we're going to get into that today. The vagus nerve falls in that parasympathetic division. The parasympathetic division is really talking about healing. It's rest, reproduction, rejuvenation, recovery, making sure you're balancing your hormones properly, digesting your food properly. All of those functions need to happen in the parasympathetic side of the organs. Now on the sympathetic side, you're talking more like stress tone. So there's always times when your body is stressed, it needs to be able to get out of a scary situation or a dangerous situation. We need to make sure that your stress tone is also at a good, well-functioning level. And the key thing is that there's balance between these two systems. So there needs to be a good balance, a dynamic balance between the parasympathetic and sympathetic side of this coin. So we want to make sure, especially in my office, we want people to be way more on that parasympathetic side, where they're able to get the most healing out of their body. They're able to rest. They're able to, it's important to be able to reproduce too, but balancing your hormones, making sure that your system's actually going through recovery. Sleep needs to occur in parasympathetic. We always talk about it's virtually impossible to sleep if there's a tiger in the room all the time, right? So we want to talk about the stress tone and how we can shift your body into a more parasympathetic dominance, okay? So again, I mentioned right now, the tiger in the room is the big thing. We need to shift you out of the tiger in the room and into more like floating on clouds. We want your body to be in a state where it can actually do the healing it needs to do. And you can't be on the gas pedal and on the brake pedal at the same time. So we have to be able to shift you dynamically back and forth. And most people, they get stuck with the tiger in the room. They get stuck just stressed all the time. And I'm sure you may be the person, or you know people in your lives that are constantly stuck with the snake chasing them or the tiger in the room, okay? So, a little Lord of the Rings analogy here, but I like to say that this is the one nerve. The vagus nerve truly is the one nerve that really does rule all. It controls a big portion of that parasympathetic side of the coin, that rest side, the reproduction side, the digest side, the balancing your hormone side. So it's really important that we can get this one nerve firing at all cylinders. One of the really cool things about the vagus nerve is that it is connected to all of the systems in your body. It's connected to almost all of your internal organs. So the brain, the mouth, the eyes, the liver, the spleen, gallbladder, going all the way down to the kidneys, reproductive organs, your vagus nerve influences the function of all of this. So it's super, super important that when we talk about the functions, again, we're talking about things that are going to keep you healthy. What are the normal day-to-day processes that your body has to be able to accomplish in order to keep you healthy all the time? Right? So the functions of the vagus nerve include things like in the brain, you're talking about anxiety, fear management, mood, controlling taste, saliva production, tear production, increasing stomach acidity, gut motility, enzyme production, just measuring your heart rate variability, which is something we're going to get to in a second here. But it's really, really important that your body can do these types of functions on a day-to-day basis. And one nerve is has a huge influence on all of these different functions. And if that nerve isn't functioning properly, we know that there's going to be problems down the road. So what's crazy is that the vagus nerve also does this crazy thing called neuroception. So I think we all are kind of aware of this, but just to put this into words, there's a concept where your body can sense at any given second if things are safe or not. So we want to be able to tell and distinguish if a situation, an environment is safe. So I'm sure you've been in a situation that you didn't feel safe in, right? Maybe it's at a dinner with your family, there's somebody like maybe an ex-girlfriend or boyfriend that you have at the table or something, and you just don't feel safe. There's never like a point in the meal where you actually feel comfortable, and you're always on edge. Your body can sense that before you even think about it, and it consciously, physiologically starts changing how your organs are working. It starts changing how your nervous system is functioning. So the vagus nerve is is also very important for how your body is sensing safety and how it's perceiving how it can adapt and interact with the world. So adaptation is going to be another key factor here. The vagus nerve is important in how your body is adapting. Okay? So as a chiropractor, the reason that I'm very, very specifically focusing on your vagus nerve is because of how intimately connected it is with your upper cervical spine. So when we look here, your upper cervical spine it's mostly the world, right? They say Atlas held up the world in Greek mythology. But your brainstem is right here. And your nodos ganglion, this is called your nodos ganglion of the vagus nerve, it sits basically even with your transverse process. So the transverse process is a contact that we use in chiropractic. But one thing that's very, very important that we understand is that when this is injured, and it's something that I want to show a quick video here, that if it gets injured or if it takes a beat, if it just takes the wrong type of movement, you're talking about babies that are born and are getting extracted out of the womb with different types of techniques that modern Western medicine utilizes these days. But these techniques are very, very traumatic to the upper cervical spine. They've done research to show that 95% of babies have some type of cervical spine trauma following just the normal birthing process. So we'll make sure that we get to watch this video. I just want you guys to watch and see what's happening to this baby's upper cervical spine as this happens here. All right, so did everybody see how traumatic that was? They're talking, the doctors are most literally the doctors wash their hands clean as soon as they walk out of the room, and they're no longer responsible for that trauma that they potentially just caused to this baby's spine. Okay? So when we talk about symptoms of vagus nerve dysfunction, things that start to cascade after that first insult to the vagus nerve occurs, now you're talking about a lifetime of other traumas that start to occur. Whether you get in a car accident, maybe it's a concussion, other types of whiplash injuries, just even sitting in poor posture with your head forwards for too long, which is rampant in our population. These can all lead to vagus nerve issues and vagus nerve dysfunction. So you're talking about everything from brain problems, depression, anxiety, dizziness, and let's even skip ahead to multiple sclerosis, cancer, heart disease. These are very serious illnesses that plague our society. As neurologists, chiropractors, cancer doctors, everybody who's working together to help people get better, we need to be looking at some of these factors that are able to get your body's, again, innate ability to heal itself without having to use more drugs, without having to put somebody under the knife to get another surgery, without having to do chemo, radiation, and things like that at the level that we're having to do them right now. Okay? So we want to talk about some of the natural things that we can do as well. This is my website at drquon.com. At the website, we have a list of research articles specifically on the vagus nerve and how innate healing happens and homeostasis happens when you're able to get ideal vagus nerve functioning. And the cool thing about this is these are not chiropractic articles. These are articles done by medical researchers, oncologists, people from all over the world that are talking about the same conversation that I have in my office every single day. So I just want to go through some of these articles real quick. But when we talk about the vagus nerve, again, it's way more than just pain. It's way more than just this nerve that attaches to your heart and things like that. It's actually affecting and modulating every process in your body, everything in homeostasis. Again, homeostasis is equilibrium, but it also influences appetite, mood, inflammation in your body. Okay, and to skip ahead for even more inflammation stuff, there's other articles that talk about how it actually controls the inflammatory reflex that controls how your innate immune system's functioning when it has to adapt when there's pathogen invasion or when you have tissue damage or tissue injury. So it's a really, really key thing that your vagus nerve is functioning properly. It's also indicated in things like metabolic syndrome and type 2 diabetes, which we know is rampant in our population again, and there's not a whole lot of good natural alternative therapies to do in the medical doctor's eyes and some of the other neurologists' eyes, right? So we want to make sure that we're doing as natural things as possible to reduce your inflammation, to reduce the burden of metabolic syndromes, type 2 diabetes, obesity, and other types of chronic disorders that people, I think over 50% of Americans nowadays are going to be obese, okay? So this is a really, really cool study that talks about that based on all of the clinical reviews and all the research that's out there, if you have a high-functioning vagus nerve, it actually increases your prognosis. It increases your body's ability to heal from cancer, even in metastatic stages, which is incredible. Again, this is from the Journal of Oncology 2018. So again, this is not a chiropractic research article, but it's a chiropractic conversation for me. Because if we can affect the vagus nerve, if we can get your heart rate variability to change, and if it's going to affect all of the systems in your body that are helping calm cancer, that are helping your body's natural abilities to heal itself from cancer, we can reduce the burden on healthcare and on the medical system in general. Okay? So heart rate variability scans are very important to me. We know that this is a very accurate measurement using some of the things that we do here at the office, but we want to see most people come in subluxated. In my office, we call subluxation this interference between the brain and the body, and making sure that we can remove that and allow your body to function and get your brain the best information to work with. So when you're subluxated, you're functioning in a very, very low functioning state. You're also shifted into the sympathetic dominant side where you're stressed all the time. You're stuck in that stress tone with the tiger in the room. So as we get you adjusted through courses of care, and some courses of care for some people might be a couple days, sometimes it's more like 12 weeks. Sometimes it's even beyond that for some people. But we need to be able to track how well we're shifting your body into that healing dominance phase. And that gives us a lot of information about how your body is ultimately adapting in any given situation. We want stress adaptation. We want you, obviously, we're not going to be able to eliminate all the stresses in your life, but we are going to be able to change how well your body is able to adapt to that stress. And that's the key thing, is it's adaptation processes. We have to get your body more resilient to stress. So heart rate variability, again, is a tool that we've used in chiropractic, and it's been validated as a very, very good measurement of how well your vagus nerve is functioning and how well we're doing as chiropractors to correct your subluxations. And that's ultimately my goal, is to make sure that we're doing our jobs as effectively and as efficiently as possible, and objective measurements always help us to make sure we're on the right track, okay? The other thing that's really important is that we know that chiropractic adjustments have the power, especially at the upper cervical spine, to decrease stress tone and increase the function of the parasympathetic nervous system, which again is mostly vagus nerve functioning. So as a chiropractor, if I can do an adjustment on you, and it's one adjustment potentially, that's going to change the function of your vagus nerve, this is implicating everything in your body. Again, your vagus nerve, like we talked about earlier, is connected to almost all of your internal organs. If we can get this nervous system functioning at an optimal level, your body innately knows how to heal. It knows what to do to heal. It knows what resources to utilize to heal. Now all we have to do is just let that interference, remove that interference and let the body heal. Okay? And we know in chiropractic that when you get adjusted, without a doubt, at this point in 2019, it's never been a better time to be a chiropractor, as all of my mentors say. But truthfully, there has never been a better time where there's more research about chiropractic and the brain and how ultimately your brain, your nervous system, your vagus nerve, all of these neurological connections, when we can free that system up and we can free how your brain is communicating with your body does amazing, miraculous things to heal itself. And that's something that I see every single day in my practice. I wish you were all here so you could see some of the patients and hear some of the stories from these people. But even I didn't believe it at first. I'm from a medical family. I've seen people go through rounds of antibiotics. I've had people go through surgeries, cancer treatments, all kinds of stuff, and it fail. And then you see these people that come in and they work on their brain, they work on their nervous system, they work on nutrition, they work on exercise, some of the other things that we teach at the office to get your stress adaptability better. When we can work on these things, your body does the healing every time. And it's just a matter of how fast can we get it to happen. So that's truthfully my message to all of you, is we need to get more people to understand how powerful not just chiropractic is, but your body's ability to get stress, your body's ability to adapt to stress is the most important thing. Chiropractic, for me, is one of the best modalities that we can use, one of the best procedures. Chiropractic care is so powerful in how we can get more people better adapted to stress and better adapted to healing, the innate way that we were created to live. So I hope you enjoyed this. This is Dr. Quon, and I'm really excited again that you guys all get to listen and share this. Hopefully share this with your friends and family, and it'll be my honor to be able to serve your people one day.